Change was a distant word. There was a time that we'd only encounter it a few times in a decade. Today, I know that every day will bring change. There will be moments where I'll embrace it, but most of the time, I know I'll resist, hoping to fold the edge of the page of what has become my favorite story yet. I knew you before I met you. That's a funny thing. But I still had so many questions about you and to ask you. The pain with which you came left me breathless. From then on, nothing has been the same. I see myself in you, and in the same time, I see all that you do through you. Discovering every color and note with you, learning how to smile despite the weirdness, developing the handy skill of doing everything half asleep, staring helplessly at every how to parent guide available. Those first few months felt like a blink, so I kept my eyes open, hoping that I wouldn't miss a thing. These moments are rare, but I know that even for a little while, on days like today, when the wind's still and the sun lingers, I can take a mental picture and hold on to this memory, comforted that it will never change.
Sa pagpili ng diaper, kailangan comfortable kay baby at affordable kay mommy. Kaya choose Huggies Dry Pants. Ang diaper na may total dry comfort sa presyong panalo. May quick dry layer that absorbs up to 7 cups of wee-wee and a leak lock system that locks it inside. Para palaging dry at happy si baby sa presyong panalo kay mommy. Huggies Dry Pants. Total dry comfort sa presyong panalo. Also available, Huggies Baby Wipes.
Mula sa una mong iyak hanggang sa una nating yakap, wala akong ibang iniisip kundi ang alagaan ka.
Ang Huggies Dry Newborn ay may runny poo leg guard at all-around cottony softness. Kasama mong mag-aalaga mula sa una hanggang sa susunod pang mga yakap. Huggies Dry Newborn. Also available, Huggies Pure Clean Wipes.
You, honey body, when you coming out for gameplay, I got my checkers out, chest part cheesy. Oh yeah, honey body, you make me want to play with you. And if you wanna bring your dice,
Change was a distant word. There was a time that we'd only encounter it a few times in a decade. Today, I know that every day will bring change. There will be moments where I'll embrace it, but most of the time, I know I'll resist, hoping to fold the edge of the page of what has become my favorite story yet. I knew you before I met you. That's a funny thing. But I still had so many questions about you and to ask you. The pain with which you came left me breathless. From then on, nothing has been the same. I see myself in you, and in the same time, I see all that you do through you. Discovering every color and note with you, learning how to smile despite the weirdness, developing the handy skill of doing everything half asleep, staring helplessly at every how to parent guide available. Those first few months felt like a blink, so I kept my eyes open, hoping that I wouldn't miss a thing. These moments are rare, but I know that even for a little while, on days like today, when the wind's still and the sun lingers, I can take a mental picture and hold on to this memory, comforted that it will never change.
Sa pagpili ng diaper, kailangan comfortable kay baby at affordable kay mommy. Kaya choose Huggies Dry Pants. Ang diaper na may total dry comfort sa presyong panalo. May quick dry layer that absorbs up to 7 cups of wee-wee and a leak lock system that locks it inside. Para palaging dry at happy si baby sa presyong panalo kay mommy. Huggies Dry Pants. Total dry comfort sa presyong panalo. Also available, Huggies Baby Wipes.
Mula sa una mong iyak hanggang sa una nating yakap, wala akong ibang iniisip kundi ang alagaan ka.
Ang Huggies Dry Newborn ay may runny poo leak guard at all-around cottony softness. Kasama mong mag-aalaga mula sa una hanggang sa susunod pang mga yakap. Huggies Dry Newborn. Also available, Huggies Pure Clean Wipes.
With you, oh honey buddy, what you doing Sunday? Maybe sipping the Coca-Cola with me, babe. Oh yeah, honey buddy, yeah. 'Cause everybody wants a honey buddy someday. Mama said it'll grow on the trees easy.
Change is a distant word. There was a time that we'd only encounter it a few times in a decade. Today, I know that every day will bring change. There will be moments where I'll embrace it, but most of the time, I know I'll resist, hoping to fold the edge of the page of what has become my favorite story yet. I knew you before I met you. That's a funny thing, but I still had so many questions about you and to ask you. The pain with which you came left me breathless. From then on, nothing has been the same. I see myself in you, and in the same time, I see all that you do through you. Discovering every color and note with you, learning how to smile despite the weariness, developing the handy skill of doing everything half asleep, staring helplessly at every how to parent guide available. Those first few months felt like a blink, so I kept my eyes open, hoping that I wouldn't miss a thing. These moments are rare, but I know that even for a little while, on days like today, when the wind's still and the sun lingers, I can take a mental picture and hold on to this memory, comforted that it will never change.
Sa pagpili ng diaper, kailangan comfortable kay baby at affordable kay mommy. Kaya choose Huggies Dry Pants. Ang diaper na may total dry comfort sa presyong panalo. May quick dry layer that absorbs up to 7 cups of wee-wee and a leak lock system that locks it inside. Para palaging dry at happy si baby sa presyong panalo kay mommy. Huggies Dry Pants. Total dry comfort sa presyong panalo. Also available, Huggies Baby Wipes.
Mula sa una mong iyak hanggang sa una nating yakap, wala akong ibang iniisip kundi ang alagaan ka.
Ang Huggies Dry Newborn ay may runny poo leak guard at all-around cottony softness. Kasama mong mag-aalaga mula sa una hanggang sa susunod pang mga yakap. Huggies Dry Newborn. Also available, Huggies Pure Clean Wipes.
Change was a distant word. There was a time that we'd only encounter it a few times in a decade.
Good morning, everyone. How is everybody this morning? My name is Isa Fabregas Cuna, and you are back with me for another Mommy Mundo event. Today, we are talking about birthing methods. Oh my goodness, moms! We know how relevant and important this topic is. I have just given birth. I gave birth last April, and I actually have given birth twice already. And this topic is relevant each and every single time. And even after giving birth, birthing methods can leave lasting marks on our bodies and on our minds. And so it's so important to be informed. It's so important to feel empowered about making these choices. And I know you know what I mean. So if you are a new mom or about to be a mom again, then stay right here with us because we've got lots to discuss with you. Now, before anything, I want to acknowledge the platform that makes this all happen. Since 2003, Mommy Mundo has been sharing what it can, what it knows, and what it loves by advocating healthy pregnancy, breastfeeding, active parenting, and mompreneurship. We provide information and support to moms in the various stages of their mommy journey in ways that are inspiring and empowering. And we also want to thank our sponsor this morning, Huggies Philippines. To moms and dads out there, especially the new parents, we know that you have been reading a lot of how to parent tips online. I do it all the time, every single day, around the clock. So we are so happy that because Huggies offers exactly this through their online parenting community, Huggies Club. Huggies Club aims to empower moms with relevant information about parenting and diapering. And Huggies Club is also a loyalty program for our Huggies community. So as a member, parents can enjoy exclusive discounts on their Huggies favorites. So what are you waiting for? Moms and dads, sign up now by visiting huggies.com.ph. Also, be sure to visit the Huggies Shopee and Lazada official stores today and get the Huggies Dry Newborn for as low as 6 pesos and 50 centavos per pad. Definitely, that is a great deal for starting families like yours, moms and dads. So, also, another reminder, please watch out for the upcoming Super Brand Day of Huggies on its official store on Shopee July 17, where you can get up to 40% off on Huggies Dry Newborn and Huggies Baby Wipes. Ooh, I need those wipes. So that's happening on July 17 on the Huggies Shopee official store. So what are you waiting for? Be sure to and add to cart your Huggies favorites today. So do that now, and you can visit them on July 17 and get that 40% off. All right. Now, before I introduce our speakers, I have seen a lot of you have participated in our birthing stories, our birthing bingo on Instagram. So I just want to share a few of my own birthing bingo stories. And I want to thank all of the moms that participated. So if you guys saw this earlier on, I want to share some of my own. I have given birth during the pandemic. I've given birth to a boy and I've given birth to a girl. I have a girl and a boy already. I gave birth in 2019 and in 2021. And I have had 2 C-section childbirths. And I had my husband with me in the delivery room both times. Thank you, Lord. So yeah, I have quite a lot to answer already on this birthing bingo. And hopefully you guys will as well. So thank you again, mommies, for sharing your birthing bingo stories with us. Now, before we begin, we have 2 giveaways for you today. And the first thing we need you to do is to visit bit.ly/babyhugs2021 to view the full mechanics and get a chance to win 1 month's worth of Huggies diapers. So the link is pinned in the comment section below right now. So you just have to click on that link and check out the full mechanics. And secondly, right now, this very moment, our mommies in the audience can answer in the comment section and also get a chance to win, again, 1 month worth of Huggies diapers. So the question is, what method would you choose and why? And again, you can share your heartfelt answer with us along with the presentation of our guest speakers today about birthing methods. So answer in the comment section below and you might win a diaper supply worth a month from our dear friends at Huggies. All right. I hope you guys are all settled and ready and excited for our topic this morning on birthing methods with our two speakers for today. I am so excited. So before we move to our talk proper, we'd like to let everyone know that we're going to be presenting about various birthing methods today, but not specifically pushing or endorsing any of these methods. We would like for you to be able to choose what fits you the best, what makes you feel empowered. And so now is the time for you to learn as much as you can about giving birth and about which one of these birthing methods might be interesting for you or what you want to do for your birth. And now I would like to introduce our first guest speaker today. We have someone who is famous in mommy circles. She is a mother of 3, married and lives in Quezon City. She has been professionally involved in the field of women's health and rights for nearly a decade before becoming a mother herself. And coming out of her first home birth experience, she pursued childbirth doula certification in order to assist mothers and their families to plan out their birth preferences and help them achieve joyful, balanced, and pleasurable births. So please, everyone, welcome with me, doula Irina Otmakova-Yamat.
Hi, thank you so much
Hi.
for having me here.
Good morning. Good morning, Irina. We're so happy to have you with us.
Thank you so much, and congratulations on the birth of your new baby.
Oh, thank you. It's been 2 months with 2 under
Okay.
2.
Okay, you're awake. You look wonderful.
I am. I thank you. I managed to put makeup this morning.
Okay. Yeah, thank you.
We're so excited to have you present on birthing methods. So
All
go
right.
ahead.
So floor is mine. Okay. Okay, so hi everyone. Thank you so much for having me here again. And thank you for the introduction. So if you are still new with the concept of doula, just let me mention a few things about that. Who is a doula? Doula is a professional birth companion who is strictly not medical. So doula is there with the mother to respond to her needs, to help her find the information and help her make informed choices during pregnancy and during the entire process, birthing process, and right after. A lot of times for me, practically, it comes to a lot of back massage. So the physical support is also there. So doula is someone who mothers the mother during the very intense and transformative process or in your life, which is childbirth. Okay, so this is it for my own introduction. We can move to the next slide. All right, so we're going to be talking about the birthing methods and which one is the best choice for you. But who are you, right? We mummies, you mummies. It can be many different circumstances and many different determining factors. You might be a mama in your 20s, the first time pregnant, and putting all the trust and just going with the flow with what the doctor says and recommends, which is fine. You can be also in your 30s and you already have one child and it was born through a C-section. And now you're looking back at your experience and thinking, why did that happen? I think it was a healthy pregnancy. I was ready to have a normal delivery. How come my birth went a cesarean way? Can I have a VBAC right now? And this is your main question for this pregnancy. You want to have your VBAC birth, right? You can also be a mom in your 30s. Very, very stereotypical yoga instructor, very much into wellness, and you know exactly what you want. Home birth, water birth, hypnobirthing usually comes into mind, and are the chosen ways to go. You can be just hitting your 40s and you've been struggling with fertility issues, but you're pregnant now and unsure how to handle that because this is such a precious gift. So what is right for you and what is even possible, right? You can be also in your 20s and having miscarriages in the past and having very delicate pregnancy. So and the list is so on. This is just a few given scenarios. So there is, as with everything else in life, there is no one size fits all, right? There are many different ways and many different circumstances. But for the sake of our conversation, I would like to zoom in on what is a healthy low risk pregnancy, right? And then you will see where you are in relation to that denominator, healthy low risk pregnancy, and what are the choices and what are the nuances around that, and what choices you can make. Let's go to the next slide. Okay, so there are different ways to get to the same desired outcome, because we all want to have a healthy mama and a healthy baby at the end. But the ways to get there is different. So is it going to be a hospital birth? Or is it going to be an out-of-hospital birth? Is it going to be a home birth? Is it going to be a water birth for you? What is right? So for me personally, in my practice, there are two major categories that you can see right away, whether it's going to be a medicated birth or unmedicated birth, right? And then medicated, is it going to be medicated, whether it's medical interventions or a scheduled cesarean, due to certain medical factors and the underlying conditions like high-risk pregnancy status, so like legitimate medical factors. So this is why it is medicated. Or is it going to turn out to be medicated due to how it is managed, or due to how the labor progresses, due to some unforeseen factors during the labor itself? So that's the nuance. Or unmedicated birth, is it going to be in the hospital? Is it going to be in a supported environment inside the hospital setting that will support the physiology of a laboring mother? Or is it going to be out of hospital setting? And here we have lying-in clinics that support and provide services for gentle, unmedicated water births, or even home with a qualified, licensed, well-trained medical care provider, who is usually the midwife. So these are the branches that we are looking at, right? So before we move forward, it's good to mention that through the history of humankind, because we are talking about medicated and not medicated, right? Through the history of humankind, there's always been 10 to 15% of women who would develop certain complications, certain difficulties in pregnancy or birth itself. And particularly for this group of mothers, and sometimes, who knows, maybe you are part of that group, right? So we're absolutely blessed to live in the period of time in the human development when the emergency life-saving procedures like cesarean section is readily available, right? But we also have to see at the numbers of the cesarean sections currently performed in the hospitals. In the private practices, we see really staggering numbers of 50% and beyond, 70%. So is it so that most of the women who go to the private hospitals are not capable for some reason to give birth vaginally? So this is the questions that we need to be asking. Why is it so often that the births have to go towards the surgical resolution, right? So this is just the question that we are asking. Okay, let's go to the next slide. So next slide, please. Yeah, thank you so much. Okay, this is a bit hard to see because we are in this format. But what I find it very important is to be aware and to build that awareness, because especially if you envision for yourself a gentle, empowered, transformative birth experience in the hospital setting, which can absolutely be achieved. You have to be aware of certain things. You have to be coming there very, very prepared. So on my Instagram account, Birthing Gently, the handle is hiding behind the bear. Okay, so but okay, later on we will maybe flash it somewhere. So it's Birthing Gently. Quite often I hold this collection of stories where mothers share how they felt and how they were treated during their childbirth experience. And what I receive as stories is very concerning, because this is very common when you read this. Well, I was alone in the labor room with nothing to eat, to drink, just for the whole duration, right? Just in case I needed a C-section, I was not allowed to eat and drink. I had my water artificially breaking, and then the mother ended up with a postpartum depression, right? So again, another story was gave birth during the pandemic, was not allowed to eat and drink, was not even allowed a phone with me in the labor room. So then another story, I only see the highlighted part. Again, like it's traumatic what the mothers recount, and this is from the reputable private hospitals, right? So was not allowed to move, was not allowed to eat and drink, was left alone. So for any request, it's bawal, it's not allowed. Let's go to the next slide, because it goes in the same key. So again, not being allowed to move, not being allowed to have companions, again, not being allowed alone, uncomfortable, not being allowed, right? Scared to give birth. So imagine this is the average temperature. Like this is the majority of stories when the mother comes to the hospital setting unprepared to deal with the hospital protocols. The result is healthy mother and a healthy baby. It's okay, but there is so much more to it. And obviously from all these shared stories, we can hear the frustration, like how come I'm not in a position to make those decisions? How come I'm told not to be allowed to move, to eat and drink, to have companions, to be by myself? Like, why is a childbirth setting somehow a place where a mother loses her human rights for the basic things as food and drink and movement, freedom of movement, and freedom of having the companions of choice? Okay, so those are some of the major points that always come to the surface when mothers are sharing their birth experiences. So happy with the child, happy that it's finally there, happy to have the baby, but somehow less happy and sometimes very sad and frustrated about the overall childbirth experience. Okay, so you can find, if you go on my Instagram, birthing_gently, I have all the stories, a lot of stories saved under the highlights under the title awareness. So check them out and see if you can resonate with that experience. So let's dig deeper and talk why it's playing out and what's important for a normal physiological birth. Let's move forward. Okay, so let's talk about the birth physiology. As I mentioned earlier, let's not go into the medical factors. If there are certain medical risks, if the pregnancy is marked as high risk pregnancy, if the underlying medical conditions, by all means, medical intervention, medication, close monitoring, it's there and it serves its purpose, and it absolutely has its place to be. When we're talking about the low risk pregnancies, healthy pregnancies, and spontaneous labor, so what is really important, what is supportive for the mother to go through this chapter of her life, through this journey in the most empowering and transformative way possible? And first and foremost is the respect to the physiology of birth. So what is very important is the hormonal blueprint that is very little talked about, but is crucial and important in the process of birth. As you see in the picture, we have a very intimate moment of a couple when the mother is in labor in a very sensual, sexual, intimate kiss, right? So it's not for coincidence, because birth is on the same spectrum as sexuality. The way you put the baby in is the way you put the baby out, because it's the same kind of hormonal processes that play out during labor as they play out during the baby making, right? During the love making. So what are those processes? What are those hormones? Oxytocin. Oxytocin is the king or the queen of this, of the love making and the birth. Oxytocin is the hormone of love and bonding. In labor, it instigates contractions. It also brings euphoria, and it's responsible for this amazing ejection reflex. When the mother labors undisturbed, if you've seen animals in labor, or like things like in National Geographic, where seemingly the cub just falls out of the mother without any effort, just ejected out of the body of like zebra or an elephant. So there's somehow very little effort involved, and us mothers like have to really strain and push. The secret is that we are actually capable of the same thing. When the mother labors undisturbed, there is that ejection mechanism that is activated that will simply expulse the baby out of the mother. The same way placenta, and also responsible for the milk ejection. So that's your king, the oxytocin. Then we have the endorphins, because the more oxytocin flows in our body, the more endorphins are released, and endorphins are the natural pain relief. So you can see it as a nature-given epidural that is also built in our bodies. So we are not only given the pain with the intensity of contractions that come with oxytocin, but also endorphins for the pain relief. And then we have the relaxin and melatonin and prolactin that also play a part and very important in this whole setup. And adrenaline that is also hiding behind the bear. Okay, no more. Very good.
That's great. I wanted to see it as well. I was like, I can't see the last part.
This is something that we need to keep at bay, because adrenaline is that fight and flight response, or freeze response hormone. So when the mother is scared, when she's overwhelmed, when she is basically terrified of what is happening to her and what other factors. An unfamiliar environment, a lot of people, noise, bright light. So these are very much adrenaline stimulating surroundings. So yeah, that slows down the labor, that puts the mother into that fight and flight response. So this is why we have to see in how far your environment of your choice, where you're planning to give birth, is supportive to what the birth physiology requires. Let's continue. Okay, so that's why for a harmonically flowing labor, the ideal environment has to consist of basically the following ingredients, where you feel trust and privacy, and it's warm, dark, and quiet, preferably. So just very much as like for your love making, you have to trust, you have to feel private, you have to be secluded, where you can completely relax and let go and enjoy the process. The same thing for the birth. You have to feel trust, you have to feel private, and you have to be very comfortable in warm and dark and quiet environment. So that's the ideal environment to support the physiological birth. Let's continue.
Wow. I'm
No,
just I'm learning so much. I've given birth twice, but I'm just like, this makes so much sense. I feel like I didn't consider those things also, like in, even with my first birth. So wow, I'm learning a lot.
Okay. Well, thank you so much. But I think this is why awareness is very important.
Yes.
Okay. Yeah, and again, birth physiology. In no history of humankind, you would see, in the ancient sculptures or paintings or depictions of the mother giving birth on her back. It's physiologically
That's true.
contraindicative for a physiological birth. So the mother has to be in constant movement, finding that right position, finding that sweet spot, finding that support and counter pressure from a companion, where it makes it feel more tolerable, more manageable. And it's a big difference between living through the contraction in the position of your choice, where you find that sweet spot, compared to the position that is usually being given to the mothers, which is supine, lying down, hooked up on the morning, which makes it very uncomfortable and almost impossible to go through the birth without the aid of medications. So okay, that's another part of birth physiology. I can talk endless about, and we can go over each and every position, but of course we don't have time for that. Okay, let's move forward. Right. So another thing that is being very much restricted, and a lot of mothers are complaining about, is the deprivation from food and drink. Like see birth process as running a marathon or climbing a Mountain Everest. So it demands a lot of physical effort, and the mother has to have substance. Most likely she will not want to eat a steak or like a full meal, right? So, but some light food, some light snacks are essential for the mother, something that gives a quick boost of energy. So it's also very important. But let's talk about how the current setup is. No. First, we'll see some pictures. Okay, let's move forward, and then we will come back to all of these factors and see what actually can be done. So I know the power of pictures, so I'm just not going too far on my phone gallery, just picking up some recent births that I attended as a doula. This one is, for example, is in Clinica Antipolo, where so far it's the only hospital facility, a tip for you, where water birth is practiced. The other hospital facilities such as St. Luke's Global and Makati Mat usually have a legit water birth facility, so far are not using it due to the pandemic restrictions. Hopefully they will renew it again or resume using the water birth facilities sooner rather than later, because it's been a long time. But yeah, Clinica Antipolo, it's a bit remote, but this is where you can have a water birth currently. It's possible. So this is how you can see just a few snippets from a labor, of a physiological labor in the hospital setting, which actually didn't even end up in a water birth. The water was used well for the purpose of coping with the intensity of the surges, but the birth itself had to happen outside on the bed. It was just where the labor journey took the mother. It took her on the bed, then it took her in the water, then out of the water, then back in the water, then eventually back on the table. And this is where she was coached and encouraged, and that's how her birth resolved. So when you think about water birth, don't have it as a goal in itself. Especially if you're a first-time mom, labor is a journey like this. It's not linear, it's very circular, and it may take you many different places. And the number of times it took mothers on the toilet bowl, I don't even want to talk about that, because it can also be, right? So
My goodness.
yeah, because this is where your own physiology will tell you where you feel most comfortable. If you want to feel the buoyancy of the water, amazing, by all means. Also, in my own birth experience with my first childbirth, I spent quite some hours in the water, and it was amazing until it didn't feel amazing anymore, and until my body wanted to step out and wanted to feel the firm ground under my feet and squat and hold on to my husband. And that's how my first baby was born. So water birth or not water birth, it doesn't matter at the end. but the presence, the freedom of movement and choosing where you want to be is important. And the presence of the warm body of water at any point during labor is absolutely crucial. It makes such a big difference in your birth experience. So yeah, so this is a very nice hospital gentle physiological birth, as you can see. Let's move on. This is just from the past months of June. This is another home birth. So that's another option for low risk, healthy pregnant moms. So labor at home in the comfort of your own bedroom. We also had the pool there, and the mother actually ended up giving birth in the pool, but labored a lot outside of the pool. So it can go many different ways. So okay, very nice. And as you can see, the satisfaction and the happiness, right, on
Yes.
the mouth. Yeah. And what's very beneficial is that both mother and the child are so alert and so present.
Yeah. It doesn't
Right.
look invasive. It doesn't look very invasive or yeah.
Yeah. No, like no, it doesn't make it like entirely painless, right? Or
Sure.
it's all there. It's very intense, absolutely. But again, it's the mindset of the mother and the preparation and the willingness to take that journey,
Yeah.
and the support and the environment that she chooses to have. So okay, let's move on a little bit more. Okay, so this is some international images from accounts that I follow. So again, this is a hospital physiological birth where the mother is for part of her labor in the shower cabin, with the partner pouring water on her tummy. Amazing! This again like makes such a big difference in the experience. Let's move on. There you go. That's where the birthing journey takes you on the toilet bowl. An absolutely comfortable place to sit and to push and to exert that effort. Here the mother is like shifting her hips, so probably helping the baby to navigate the down the birth canal. So again, this is the physiology, also a hospital setting where the movement is supported. Okay, let's move on. Okay, a few words about pain, because usually when we talk about birth, it's like, oh, it's painful. It's I don't know if I can take it, if I have a high tolerance for pain or low tolerance for pain. But again, it's all about the mindset, and this is where you prepare to see pain as being purposeful. It's there for a purpose to bring the baby to this world. It's something that you anticipate. It will be coming every 5 minutes or towards the end every 2 minutes. So you prepared for it. It's intermittent. It's not a constant. It's something that gives you breaks, quite some breaks in between. So you just anticipate, you prepare, and you practice how to flow through that. And it's natural, it's normal, it's caused by those hormones that we discussed before. Okay, so that's a few words about pain. Okay, let's move on. And yeah, that's your triumphant row at the end. So did it, and it's amazing. So this is the like physiological birth in a nutshell in 10 minutes with a few illustrations. I have a whole course about that, 5 weeks. So it's a 5 weeks worth of talking and reading material. But this is just in a nutshell for you to see how birth can look and feel like differently compared to what we usually see from the mainstream media, and compared to the expectations of birth that we mostly carry from our childhood onwards, that it's something very painful, very traumatic, that's something that we barely have any control about. So it's mostly a misconception. Birth can have a very different side to it, and this is what I'm trying to show you today. But let's look at continue with the next slide. let's look at how the mainstream hospital is set up, is working right now, right? So as I was telling in the very beginning, there is always a group of women who need to have emergency treatment or whose pregnancy high risk. So by all means, the medical procedures that have been put in place are there to serve that purpose. However, over the period of time, with the medical procedures like continuous fetal monitoring or placing the mother on her back or depriving of food and drink, became a routine that do not apply just for the high risk cases, but for everyone. So it became a practice that is just applied for each and every single laboring woman. And does it do good or does it do more harm than good? So this is a question that we have to ask ourselves. So how come we have such a high rate of cesarean births, right? Paired further with the restriction on companions and then restrictions on the pushing positions. Believe me, like for some mothers, it does come naturally to lay down on the back and push. That would be the very minority. For most of the mothers, it will be something in between the squat or all four position, anything other than really laying on the back. So this is what the setup is right now, okay? And then with the next slide will show us if those practices and procedures are applied routinely rather than on a valid medical indication. It becomes a cascade of intervention. Okay, so I can also elaborate on that very much in detail, but for the sake of this presentation, it's just for your awareness. Research more on the cascade of intervention. Sometimes the entry point for the cascade of intervention is the mother is being put on her back and hooked up on the continuous fetal monitoring device. To monitor baby's heartbeat and the frequency and the intensity of contractions. Totally valid, totally fine. And if the reading is good, 30 minutes is enough. And then for the rest of the labor, it can be done intermittently just to make sure the baby is faring well. However, because it is just more convenient to have mothers on the monitoring in their cubicles, and the monitoring is reflected on the screens, so it's just more overviewable, but for the staff. So that's why most of the mothers just stay on their back, hooked up on the machine. While we all know that in the physiology of labor and birth, they have to be moving around, and if there are no concerning signs with the fetal heartbeat, that's it. Like, let the mom move around, find her sweet spot, and then monitor on a different, like intermittently through the course of labor. So the cascade of interventions may start there. The mother is put on her back and left there, and of course the intensity of the contractions will increase over the time, and she will ask for the epidural. And the one side effect of the epidural is that it may slow down the labor. Why? Because it interferes with the pain signal from the lower body to the brain. That basically, while the pain signal is done and gone, so the body is no longer in labor. So the brain is not sending the feedback signal to the endocrinal system to keep producing the nasal oxytocin to keep the uterus contracting, right? So epidural says no more in labor, and then you have to deliver the baby because you are actually already in labor. So, but the contractions slow down as one of the side effects of epidural. So then they give you the synthetic version of oxytocin, which is called pitocin, to stimulate contractions. So that's another drug in your body that tells your body that you are in labor, so continue contracting. So that's a lot of contradictory messages. One coming from epidural, another one is from the synthetic oxytocin. and it might eventually become very distressing for the baby, and that's where the heartbeat starts fluctuating, and that's when the call for a cesarean section is made. So the question is, if the mother was left to her own physiology, with her movement, uh, with her nourishment through the labor, with the support, with the conducive environment of dimmed lights and warm, dark, and quiet, how different the experience might have been at the end, right? So again, these are the questions. Let's move to the next slide. So this is for your awareness, and it's not something, what I'm saying, it's not something that is contradicting to the best evidence. The best evidence and the recommendations for proper protocols of labor management are out there from the WHO, from the all the societies of obstetrics and gynecology, even the local DOH. They all recommend the same thing. So for women of low risk with healthy pregnancies, oral fluid and food intake during labor is recommended, right? I lifted just a few things that are, strike to me as more important, but there's so many. So all and they all make so much sense. Encouraging of adoption of mobility and upright position during labor in women of low risk is recommended, right? Okay, I just repeated. Anyway, so yeah, moving around, movement is recommended. Food and drink is recommended. The progress, the timing of the labor should not be measured in just 1 centimeter per hour. Quite a list of things. So if you want to know more in detail, just look up that WHO recommends interpartum care and positive childbirth experience for yourself. So it's all common sense and it's all in the guidelines. But from what we see in experience, it takes a while for the best evidence to really trickle down in the implementation. So it's not yet entirely there, but this is where your agency comes in, and your commitment and your vision in terms of what kind of birth you want for yourself. So let's move on and go over a few practical steps, because it makes a difference whether you feel triumphant at the end, no matter what way your birth went, whether it went all natural and medicated way, or whether it required certain intervention, or whether it had to be a cesarean section. What matters is that the mother is the ultimate decision maker, that she is informed, that she is taking informed choices, and how she is treated along the way, because this is something that will stay with the mother for the lifetime, but how she is treated. Or you feel defeated and in doubt and questioning yourself, and looking back at the experience and looking for someone to blame. So it's a very different states of mind and states of being as coming out of the birth, especially for the first time mother. So it matters. Let's move on. So what are the steps towards a positive birth experience? And again, as we talk, it can be a hospital setting, it can be medicated for a reason, it can be unmedicated or medicated at the end, again, with a legitimate reason. But what you need to be aware is the setting and the team that you are choosing to be with you. So step number one, crystallize your own vision. What isn't for you? What do you want to have? What doesn't work really is just going with the flow. Usually it leads to misconceptions and mismanaged expectations and surprising outcomes. Just going with the flow, just doing as you're told, just not doing the research, not comparing your options. that going with the flow might work out and might not entirely work out, right? So, and if you have that vision for the birth that you want, find a care provider, OB or midwife. Again, depends on your pregnancy status, right? Low risk, high risk. So, who is going to be your main care provider? Who is the right match for your vision? For example, for the VBAC mamas, those who would like to have a vaginal birth after cesarean. According to the best evidence, yes, it is the safest way to do. It's again, as long as the pregnancy is healthy, a vaginal birth is safer than a repeat cesarean section. But there is a lot of misconception, a lot of fear, and very few practitioners who embrace that best evidence and are supporting the mothers in their VBAC desire, in their VBAC plans. So if you are VBAC mom, seek out a provider who has an excellent track record in supporting VBAC births. If your OB or the chosen OB or who has been recommended to you responds to your request, okay, can I do a VBAC, or am I a good candidate? With the evasive answers like, okay, let's wait and see, or outright no because of the risk of uterine rupture, be aware that there are other doctors out there who do support VBAC, who have a VBAC success rate of 9 out of 10, for whom VBAC is just like any other birth, just requires a little bit more monitoring, preferably in the hospital setting, but it's absolutely doable. So that the OB who has a good track record in supporting VBAC birth will be a good match to your VBAC goal. If you feel that the messaging of your care provider is ambiguous or evasive, or just like let's wait and see, and will probably not achieve the VBAC because it's not the mindset, or it's not the practice, it's not something that your OB is comfortable doing. So it's also not unfair to push your practitioner beyond their comfort zone. So seek out somebody who is comfortable and capable and who has already a track record. So this is just one example of finding the right match. Or if you want to have a water birth and you ask your current care provider, how about water birth? Can you help me with that? Or I've never done that, or it's not something that I support. So again, if this is something that you want for yourself and you get that response, so you're not a good match. So find someone who is a good match for you. All right. And on the other side of the spectrum, if your pregnancy is more on the high risk, you want it to be meticulously medically managed in each and every single step of the way, and this is how your care provider is showing herself or himself being meticulous and very medically minded. So maybe this is just the right care provider for you. Okay, so again, where you are on the journey, you will know, only you will know. Step number 3, physical, mental, spiritual preparation for your birth, and that it can involve a lot of different things. And taking a childbirth preparation class course is definitely highly recommended and to be one of them. And do make an effort to draft a birth plan. Come prepared to the setting, to the location of your birth, with a set of preferences. Let's move to another slide. So just to show an example of how a birth plan can look like. So this is definitely a birth plan for a natural physiological birth, where you emphasize your preferences. For example, the natural water rupture, you would preferably decline the amniotomy, the artificial rupture of the amniotic membranes, right? So fluid and water over the IV. So you prefer to eat, drink instead of being hooked up on the IV, and you consent. Maybe if it goes the medicated way, then you will consent to have an IV line on your arm. You would prefer to keep the freedom of movement. You would prefer to be for the baby's heartbeat to be monitored intermittently rather than constantly, provided it has been a good baseline and it doesn't give any warning signs or red flags. So it's okay to just monitor it every 30 minutes or every 15 minutes or every hour, depending on what your care provider recommends, right? So episiotomy, that's another thing that is unfortunately still being very widely used as a protocol, as a practice, against, again, the best practices and against the best evidence. Vertical birth, finding position of your birth, submerging in the water, all of that minimizes the risks of tearing and minimizes the need for episiotomy. So it's much better to have the physiology and the movement and the position of choice supported rather than having a very invasive procedure done, such as episiotomy, right? So and so on and so forth. So also on the your preferences on what happens when the baby is born. So emphasizing the skin to skin, the onset of breastfeeding. You can choose whether you would like to have newborn procedures administered or right away or delayed. So you have your choices. It's a matter of taking the time and effort of exploring them all and making these decisions in advance. And of course, always leaving a room for flexibility or for any unexpected circumstances in the process itself, right? Okay, so let's move to the next. We just have a few slides left. Okay, so can we remove the bear for a little bit?
So we can see the IG account. So
Yes.
it's your IG account that they
That's
can
my
follow,
IG
right?
account, Birthing
That's
Gently.
right.
Please give me a follow. I regularly post some inspiring stories, sharing real practical insights in the births that I've attended. And every 2 months, I conduct a 5 weeks long course. It's called also Birthing Gently.
Yeah.
It's on the Instagram platform, on the private closed account, just for the participants of the course. So where we talk about all of that and nitty-gritty details. Okay, and so we have just one started, 1 week in. If your due date is anywhere in August, I suggest, or September, I suggest you can still hop in and catch up on the materials of 1 week, and we still have 4 weeks to go. But if your due date is later in the year or early next year, the next course will start in September, the first week of September. So go to Birthing Gently and click on the link in my bio to learn more about the Birthing Gently course. And of course, I also provide the online doula support for the settings where an in-person doula is still restricted, or there's a limitation on the number of companions, or in-person doula support for the home births or clinic births where doula presence is allowed and encouraged. So feel free to reach out to me to talk and to discuss your birth plans, and let's see where it can get us. Okay. Okay, let's have another one. So just would like to end with one of my favorite quotes, that whenever and however you intend to give birth, your experience will impact your mind, your body, your spirit for the rest of your life, by famous American midwife Ina May Gaskin. I see there is very much truth to that. All right, and the last one. Okay, so wishing you all a safe and smooth birth soon, for the mamas who are expecting and for the mamas who are still preparing. hopefully the time will come, and I can wish you that as well in person. Okay. Thank you so much.
Thank you, Erna. Thank you so much for speaking. Thank you for sharing with us, your experience, some of your experiences, and this empowering knowledge. Honestly, what I took a lot of notes.
Okay.
I learned so much, and what I really love that what I love from what you were saying is that it really is possible to have a healthy mom and a healthy baby and have a blissful birth, and to have an empowered birth. I completely agree with you. Even just sharing my personal experience, my first birth was overwhelming, and it actually was a little yeah, it was a little traumatizing, because there were lots of things that I thought were going to happen and didn't. So and I did also get that, as long as your baby is healthy and you're healthy, that's fine. But I realized that there's more to it. You can have a wonderful birth experience, and everyone can be healthy, and
Yeah.
so and can be gentle and not invasive. And I love that. I really I will recommend to my friends, for all of them to follow your 5 week your 5 week course, Birthing Gently. And yes, everyone, please do follow Irina's IG account, birthing_gently,
Thank you.
so that you can learn more about gentle births, water births, and all of the, and especially if you want to have a great support system for your upcoming birth. Irina, I have a few birthing_gently. So I do have a few questions for you. Just 2 to 3 that we gathered from some of our comments. But before that, I will share some of the comments that we've gotten over while your talk was ongoing. Just wanted to share some of the comments, because we had a question asked earlier, like, what birth method did you choose, or will you choose, and why? And so I'm just reading out loud from here. This is from Mama Mia. Mama Mia, or Mommy Mia, and it says, "Hello, Huggies PH. I love Huggies diaper for my baby. It's 100% breathable, with an outer cover and quick dry layer. It's super absorbent. As a mother of two angels, I have a 3-year-old and a 1-year-old, and both of them were normal delivery. But for me, it's not easy when there are times of labor. It's too painful for me. But when my baby comes out, it's worth it. No pain, no hardship. Hashtag proud mother of two." That's true. It's beautiful. Even if there's pain, it's a beautiful experience. Another comment is from Mama Meow. Emergency CS ako sa baby ko. Mahirap after ma-CS. Halos 1 month kang hindi makakilos ng maayos. Plus, laging payat kay baby. Pero worth it naman lahat ng pain. Pag nakita ko ang smile ng anak ko, 2 years old na siya, na yun, since birth, Huggies user siya till now. So, those are just some of the wonderful comments from our parents, and sharing their birthing experiences. And so, Irina, I have a few questions for you. Just hopefully you can. And then I have also my own question, because again, I had a few notes. So, asking Irina, is it common to poop while giving birth? This is a very popular question.
Yeah. Yes, it is. And
all right.
Nothing to be overwhelmed or ashamed about. It's simply the pushing basically involves the same pressure on the same kind of nervous endings, and the bowels are just there, and it becomes part of the whole process. A bit smelly, but what why not? So the care providers who are with you, even if it's waterbirth, they're completely not disturbed by that. They know that it happens. There are a few fishnets if it's a waterbirth, so it's been scooped out, throw away. You don't have to think about it, and moms that don't even notice that it happens. So it's nothing to worry about at all.
All right. Yeah. Well, that was just one question, but allow me to gather a few more questions, actually, and later we'll have both you and Doc Majoy actually answer in our Q&A. So we'll move it a little bit after her talk, so that we can take some time to get some more questions. Thank you again, Irina, for your time. So now let us move on to our next speaker. Thank you all for the staying on with us. For this session for birthing methods, and now our next speaker is the section head of the reproductive endocrinology and infertility in Makati Medical Center, a clinical associate professor in Philippine General Hospital. Let us all welcome Doc Majoy Christy Limson. Doc Majoy, hello. Hi, Doc Majoy. Are you there?
Hello. Can you see my
Hi.
screen? Yeah.
We can see you.
How about my
And yes,
screen?
there.
Yes.
Now we can see your screen.
Okay.
Yep.
So let's make this quick. No, I don't think I have a lot of time to. It's just short discussion. So I am a doctor. So I am one of those who actually, deliver in the hospital. So I would like. This is just a chance. A lot of things Irina already discussed, and I think I agree with her. Birthing is a choice. Mothers will always have options. And I think being able to communicate with your healthcare provider, be it a doula, be it a midwife, or your doctor, is a key in the birthing process. So you will have a satisfactory and a pleasant experience to be able to, the end goal is to have a healthy and safe delivery for a
That's
healthy
right.
mother and a healthy baby. Okay. So, the 3 babies are born per minute here in the Philippines. So that's a lot. No? So, just quickly, a question that I always get is when should I actually go to the hospital? So, you'll have to be able to differentiate true versus false labor. So, true labor, it doesn't go away when even after you walk or you change position, it becomes stronger over time. Intervals become shorter. So instead of becoming, they start coming every 10 to 20 minutes, it starts becoming shorter. The intervals become 5 to 7 minutes. Um, the contraction is usually located at the back and move to the front for true labor. And there may be some bloody discharge, or what we call bloody show, means that the cervix is actually effacing and dilating already. So there is this rule, 5-1-1 rule. So every 5 minutes, contractions lasting for 1 minute, okay, and it uh, continues for an hour. So if that happens, maybe it is time to get in touch with your healthcare provider or go to the hospital if that is where you plan to deliver. So when should you go to the hospital? Watery vaginal discharge, even in the absence of uterine contractions, because there will be a risk of infection if the rupture of bag of waters is too prolonged. Also, if there is note of decreased fetal movement and with the danger signs of pregnancy. So what are the danger signs of pregnancy? If there is excessive vaginal bleeding. So I mentioned earlier about bloody show. So that's just a bit of mucoid bloody discharge, and that is okay. But if the bleeding is a lot, almost like menses, that is not normal. So maybe you do have to get in touch with your healthcare provider. Convulsions are, of course, not usual. Severe headaches and blurred vision might be signs of high blood pressure. If you are also febrile and too weak to get out of bed, and if you have severe abdominal pain and fast or difficult breathing, these are not normal during labor. So just a few concepts to discuss about what were already mentioned earlier. So in the hospital, we have this device that we call fetal monitoring. So it actually monitors the baby's heart rate using a tachomonitor. And we check a few components. So there's fetal heart rate, variability, if the heart rate accelerates or if the heart rate drops, and how these drops are actually related to contractions, and the strength and frequency of contractions. So this tells us whether or not a baby is doing well while in labor, with the stress of labor, with the stress of contractions, okay? If the baby is actually tolerating it well. So the recommendation for patients who have who are like what we classify as low risk is to at least do a trace every 4 hours while in labor. While those who are high risk or very high risk, sometimes we do recommend continuous toco monitoring. So what is this thing that we call cervical priming, labor induction, labor augmentation? So these terms sometimes are used interchangeably. Cervical priming is something that we recommend or we do. We try to soften the cervix, okay? So when we are trying to effect a normal delivery, sometimes we want to soften the cervix before giving agents to try to make the uterus contract, okay? So labor induction is when we sometimes we give oxytocin or pitocin, just like what Irina mentioned, and to bring about contractions or to simulate the advanced stage of labor. So we do these things when medically we think it is indicated. So when a patient is diabetes, usually with poor control, or we want the babies to, we would like to consider delivering by 38 to 39 weeks. If the patient is hypertensive, okay, we think that if once the baby reaches term to around 37 weeks, then we think that it might be time for the baby to come out. So we don't necessarily recommend a cesarean section, but we will try to effect a normal vaginal delivery. However, we would probably consider cervical ripening and labor induction for these patients. In patients who have ruptured bag of waters, there is always that risk of infection with prolonged rupture. So we would, especially let's say a patient comes 1 centimeter rupture bag of waters with no contractions. So we will try to effect labor. And if the baby is small, so we believe that maybe at this time when the baby's term, maybe it's better for the baby to be outside the mother's womb and grow outside than it is for the baby to stay inside, okay? And for post-date babies, so those babies are already about 41 weeks, we would want them to deliver already. But that doesn't mean when we say we want them to deliver already that we have to do a cesarean section. It just means that we will still try to, prime the cervix, make it a bit softer, make it more receptive, then try to do labor induction. So we have a couple of agents that we use for that. So labor and augmentation, on the other hand, is when there are contractions, but they're not very frequent and not very regular. Okay, so let's say your contractions lag. You were already admitted, and then your contractions started lagging every 10 minutes. Then we would want to make them a bit more frequent and a bit more regular. So amniotomy, or breaking the bag of water, this is when we use a small hook. It looks like a crochet hook, and then we do a gentle internal examination, then try to hook the bag of waters, and this is also known as artificial rupture of the amniotic membranes, okay? So when do we recommend this? Sometimes we recommend this when we do see on fetal monitoring that the trace of the baby is not okay, all right? So when the trace is doesn't look very good, we want to see if the baby already pooped inside, no? So that's if there's meconium staining already. So this will also give us some clues on how to proceed with the labor and what recommendations we will give. Okay. Now this is the episiotomy. I agree with Irina. This is not something that should be done routinely. So it is actually a surgical incision. So we make a cut in the perineum. So that is the area between the vagina, the posterior fornix, and the anus. Okay. So we make a cut to allow the baby's head to come out. So sometimes if the opening is really, really very tight, and we think that the tears might actually be worse if we don't make a clean cut, then we make a small incision, a small episiotomy, and then we suture it up after. Okay, but if the vaginal, if the introitus is very good and the head is just coming out nicely, then we are patient. We give perineal support, and then we don't do an episiotomy, and the baby comes out without any tear. So now we talk about labor pain relief. So I believe that, Irina mentioned this as well. And it's one of the first things that the patient actually has to decide on how, she wants her delivery to be. Because there are, of course, women have different levels of pain threshold. So if a woman knows herself very well and she knows that she has a very low pain threshold, there are women who say, actually, right away, Doctora, I will want some form of anesthesia. Okay, I want my labor to be a bit more comfortable. And there are those who say, Doctora, I want to try. And then we respect the wishes of these women. And from there, we give options. So there are breathing exercises that can help with labor pain. And there is water birth. This was already discussed earlier. And there is also the standard epidural anesthesia. So this is what's usually called as a labor anesthesia. So there is a needle. If you take a look at this, it's a fine needle that is put through the back, okay, to get to the epidural space, and they will put in a small catheter there so they can keep on pushing some medication that will seep through the dura to get to the nerves, okay, to afford pain relief. So I don't promise painless labor if the patient is giving epidural anesthesia, but what we try to aim is a less painful labor and delivery. Spinal anesthesia that can be given, it's one shot, so it can't be given continuously. And for some patients, when we are already trying to repair or some lacerations, and we give local anesthetics. Okay, so Lamaze is one of these breathing techniques. So the goal of Lamaze is to increase a woman's confidence in their ability to give birth. And the philosophy is actually birth is normal, natural, and healthy. That women actually have a right to give birth free from routine medical intervention. So it's actually a choice. So there are classes there that will help women learn how to respond to pain in ways that both facilitate labor and will increase their comfort. And it doesn't explicitly actually encourage or discourage medications, but it seeks to educate the women about their options so that they can make a birth plan that will suit their individual needs. Okay? So water birth, part of labor or delivery, or both can happen while in the water. So this was already also mentioned earlier. So it's known as gentle birth. So it's the water serves as a natural pain relief and aids in relaxation, but we usually recommend this for uncomplicated pregnancy. So we have done this, like Irina said, no, Makati Med and St. Luke's Global have water birth facilities, but we have stopped using them because of the pandemic. But we wait for further announcements on whether when they will resume. Okay, so now where to give birth? Okay, so about 5.5% of Filipino women actually deliver at home. 90% will deliver in a healthcare facility. So women are more comfortable in their own environment with their family, and they can have as many people present as they want. Midwives can attend to the labor and birth in the woman's own home. Okay, so as opposed to hospital birth or giving birth in a lying-in clinic, so this can be done with or without anesthesia. Like we said, no. Asking for pain relief does not necessarily no pain relief or with pain relief doesn't necessarily preclude you not being able to deliver in the hospital, because you can still deliver Lamaze or unmedicated in the hospital or in a lying-in clinic. But there was a slide actually which described what were the things that are done in the hospital. So traditional birthing. So there's electronic fetal monitoring, as I presented earlier. Generally, patients labor in a room, then they are transferred to a delivery bed, and then they are transferred to the recovery room, then back to their room. But in some hospitals, there is an option of getting a birthing suite. Okay, so you labor, it's a comfortable, like it's like in a living room. Okay, it's in a nice room, a large room. Okay, and then you can labor there. And then the bed will transform into a delivery bed, okay, with stirrups, and then we deliver there. Then the baby will be also assessed there and resuscitated just near bedside, and then the baby is latched onto you. So patients do not have to transfer from one room to another. So that's in a birthing suite, okay? So generally, there is also the practice of rooming in. So we don't recommend that babies actually after delivery are brought to the transitional care unit or in the neonatal care unit or the NICU just to be observed, because we do promote rooming in, or the baby is not taken away from the mother. So now to discuss the types of delivery. So there is vaginal delivery. So when the baby passes through the vagina and delivered without instruments. And there is also what we call assisted vaginal delivery. So this can be afforded by using the forceps. So this is a forceps, okay? If you see this is a clamp that we apply over the side of the head of the baby. And once the head of the baby is out, we release the forceps and we pull the rest of the body out of the vagina. And there's also vacuum extraction. So this one, there's like a suction cap. Just try to, when the mother is bearing down, we exert some pressure just to pull the baby out. And then when the baby's head is out, we pull the rest of the body out of the vagina. Okay, so the cesarean delivery, that is abdominal delivery, can be accomplished by two different types of skin incision. So one is the panning still incision or the bikini cut. So remember, this is just the skin incision, and others will get a midline vertical incision. Okay, so my preference is usually the bikini cut. It is just a bit. It takes a bit longer to get the baby out with more layers to get through, but generally the exposure should be the same. Now, when you're talking about the cut inside the uterus, how to get the baby out, the most common cut is a low transverse incision, or what we call as a low segment cesarean section. Sometimes when there are indications, we do make a classical incision or a midline uterine incision only when it is called for, because that is a more bloody procedure. So when would we recommend the cesarean section? If the patient has a previous cesarean birth and the woman is not eligible to undergo a vaginal birth after cesarean section or a trial of labor after cesarean section. Okay. When the baby is malpresented, especially if it is her first baby, if the baby is in breech position or if the baby is in transverse position, we will recommend a cesarean section because the pelvis is untested and we do not know if we will be able to deliver the baby vaginally safely. If the placenta is ahead of the baby, so this is what we call placenta previa, the patient cannot undergo labor. If there are also multifetal pregnancies, so twins sometimes is cephalic, we still do vaginal deliveries, but if there are triplets and higher order multiple gestation, then we would usually recommend doing a cesarean section. So there's this thing that we call cephalopelvic disproportion or failure to progress. So ito po yung hindi nagkasya yung baby sa pelvis ng mom. So it means that after waiting, so now we wait at least 4 hours. If a baby's head is, if the cervical dilatation is stuck at least about 6 centimeters with no progress, then we feel that the baby probably does not really fit. Now these guidelines are actually based on lots of researches, and we do follow guidelines as proposed by our Mother Society. Okay. So also when there is non-reassuring fetal status. So remember, we monitor the babies and then we check if there are signs that the baby's not doing well or not tolerating labor very well. And this non-reassuring fetal status is persistent despite resuscitation. So what we do is we give the patient oxygen, we hydrate a bit, ask the patient to reposition herself, and then we keep on monitoring the trace. Then that's the only time when we will call for a non-reassuring fetal status and do a cesarean section. So essential newborn care. So this is what we call unang yakap. So this is something that is advocated by the DOH and WHO. So after a baby is born, there's immediate drying, and then we initiate skin-to-skin contact. So if it's a vaginal delivery, after catching the baby, we put the baby in the tummy of the mom, and then the pediatrician will usually stimulate the baby. And then after the delayed cord clamping, which is the third component, and cutting, the baby is brought to the mother's chest to initiate latching. So there's also non-separation of baby from mother and breastfeeding initiation. So again, that's the rooming in. Okay. So I usually encourage my patients to bring a birth plan when they see me 30 weeks and above so we can discuss. So I would like to know her options and preferences. And I would like her to also know about, these things that I discussed earlier and when we think they might be indicated. So every birth is a different birthing experience. Like what Isa said, her first birth was, her first delivery was very different from her second delivery. So if the patient decides in the first stage of labor, this is when there are regular uterine contractions up to the point of full cervical dilatation, she will say, "Doc, no drugs for me. I would want an unmedicated delivery." Then we will respect that. But I also tell her, at any point that you will request for pain relief, then we will give it to you. So if a patient actually asks if she can bring her own ball, I do allow that as well. So basically, when she was Irina was mentioning a patient being flat on bed the whole time, that may not necessarily be true for all. So I guess it also depends on how you communicate with your healthcare provider. As long as the patient is not in a late active phase labor, let's say the patient is not in 6 to 8 centimeters, and I would actually allow the patient to move around, but I would also want the baby to be monitored. And the only way we can actually monitor the baby properly is when the patient is hooked to the Toco monitor and she's lying supine. But like I said, for low-risk pregnancies, then we can remove that belt once we see a good trace, which we see for 20 minutes, and then just keep her on the put her back on the monitor every after 4 hours. But if it is a high-risk pregnancy, then we will want to monitor your baby very well. Okay? So if the patient prefers no IV, then she should be able to discuss this with her doctor. Free use of food and water, that is her wish. But if we are seeing some signs of fetal distress, or if we think that your labor is not progressing very well, might be dystocia upon clinical pelvimetry when we measure your bones, and we think that's a bit tight relative to the size of your baby, then we may ask you to just take sips of water, because if we do end up having to do a cesarean section, there is always that risk of aspiration if a patient just ate recently. Okay, limited cervical checks and natural water rupture. Like I said, we would sometimes recommend a rupture of bag of waters if there are signs of fetal distress. If labor is actually very slow, we may sometimes recommend that. Okay. Second stage of labor is when there's full cervical dilatation up to the expulsion of the baby. So the patient can also express her desire whether she wants to be coached or not. Okay. She also tells us whether or not she will want an episiotomy. And one of the things that the patients will usually specify, especially in the birth plan, one is the episiotomy. The second one is whether or not they will allow us or consent to doing assisted vaginal delivery using forceps or suction if we do recommend it. But remember, as long as the mother does not allow us, then we cannot, or if the mother does not consent, then we cannot proceed with that, even if we do recommend it. Okay? So third stage of labor is when the placenta is about to come out. So usually the unang yakap steps are done here. So, okay. So the newborn care in labor and delivery. Okay. So what to bring in the hospital? You will see a lot of recommendations based on your needs. Generally, I would say do not bring too much. Okay. Leave your valuables behind. Don't bring too much money. Don't wear your jewelry. Pre-pandemic, I would ask my patients to bring lipstick and maybe some blush, so the pictures will always, the mother will always look nice, no? And don't bring too much because we don't expect the mother to stay in the hospital for a long time. Okay? So just to wrap up, okay? So birthing, okay? You always have a choice and you do have options. And it is always good to educate yourself and to discuss with your healthcare provider what their options are. And Irina is right. If the goals and the way to get to the goals do not meet or not tandem, then maybe you can consider looking for a different healthcare provider that you think will be more suitable for you. So we have to be able to discuss what a woman thinks is best for her, okay? So a woman has to be prepared, but you should also be flexible and open to the possibility of unexpected occurrences, okay? So other questions to answers to establish, is the pregnancy a high-risk pregnancy? Because if it is a high-risk pregnancy, then we will really highly recommend and push for you to deliver in a hospital where the full complement of doctors will ever need. No, if we have to do a cesarean section, if we need blood products, or if anything goes wrong, now we can attend to these things immediately. And the other question is, if you do decide to labor at home, how accessible is the nearest hospital? If in case you do need to transfer, how many minutes will it take for you to get from there to point B, the hospital, okay? Traffic, non-traffic, middle of the night, or, right now, it's hard to say. So how fast can you get there if in case it is an emergency? So ultimately, we honor we try our best to honor the woman's wishes, and safety comes first. Okay, the attending may strongly recommend medical or surgical interventions, even those that you don't wish to have, if we feel that these are needed and are necessary at that point. Okay, so just one slide about COVID and delivery, how it changed everything. So it's very hard to do emergencies now, especially if a patient has no COVID swab. So usually in a healthcare facility, a COVID swab is usually required. So it will depend on where you are. So this is something that you'll have to discuss with your healthcare provider, because the validity, the type of swab, if it's a nasopharyngeal, oropharyngeal, or a nasopharyngeal swab will do, this has to be clear, because sometimes they will not accept it when you get to the hospital, and your considered a COVID suspect without a negative COVID swab. Okay, so in some institutions, they have already allowed partners to be with the wife while in labor and during delivery, but usually they will also require a swab. Okay, so I always ask my patients to wear a mask at all times unless they can't. And when the doctors or the nurses come inside the room, always put the mask back on. Okay. So generally, recommendations have been made that it is okay to get vaccinated, to get the COVID vaccine from week 14 to 33. So we consider any of the vaccines available now fairly safe. Okay, so giving birth and being born brings us into the essence of creation where the human spirit is courageous. Kailangan po matapang, it is actually stepping into the unknown, and bold, and the body a miracle of wisdom. So thank you and God bless.
Thank you so much, Doc Majoy. Again, thank you again for all of the insight also that you've shared with us. I appreciate that. I think it's important that even from what we learned from you and Irina, it's important to stay informed. It's important to be in constant communication with your healthcare provider, with your doctor, and it's important to have a good support team. And it's important, and it's your right to know your options and to have your options there for you. But of course, it's important to also remember your safety. Everyone is looking out for your safety as well, also. And I appreciate all of the information that the insight and the wisdom that you've shared with us regarding just regarding what you guys do and what it is like also to have hospital deliveries. And so I'd like to call back Irina so that we can get started on the Q&A with you both. I'll share just a few questions for you guys and you can answer. So, but my first question will be for Doc Majoy. And it's ano pong best na CS type? Yung mas mabilis gumaling at mas safe ang baby na ilabas. So obviously there are different. You mentioned there are a few types of C-section deliveries, and we'd like to know what are the safest and the easiest recovery options from those.
I think both are the skin. If you're talking about the skin incision, pan and steel, and the midline, it's faster to get the baby out using the midline incision, but it's not aesthetic. So patients
Sure.
cannot wear a bikini anymore. Wound healing, I think, should be the same for both.
Okay.
As a matter of fact, for patients who are diabetic, we will recommend doing a fan and steel incision because of the risk of infection, and they heal much better. But it takes a bit longer to do. So if it is true fetal distress, let's say the heart rate of the baby is going down, then I would prefer to a midline incision because I can get the baby out in 2 to 3 minutes. And
Sure.
the 5-minute difference between doing a fan and steel incision and a midline incision, that 5 minutes may matter in terms of the baby's safety.
Yeah.
Okay, so you also listen to what your doctor will recommend. Okay, but generally they should both be safe. Recovery should also be similar, I think.
Okay. Our next question is for Irina. Do we have to make special preparations to have a normal delivery? And is it still possible to have a normal delivery after a cesarean one? Well, actually, both of it is possible.
Yes, it is possible. Again, it should be advised by the medical care provider in terms of meeting all the parameters and how healthy the current pregnancy is. But in most cases, yes, it is a safe option and it is possible. And it's important to find a supportive care provider for that. Yeah, and in terms of preparations, yes, most of it is empowering yourself with knowledge on the physiology of birth, preparing yourself mentally and physically, and making wise choices in terms of the place and, again, your team.
Mm-hmm.
Can I add something to that about
Yes.
the vaginal birth after cesarean section? So I agree with her. No, she should be able to offer this to patients, but we have to choose the patients well, because we have to look back at the indication on why the patient actually underwent a cesarean section in the first place.
Yes.
So if it is dystocia, let's say the woman's pelvis is really small, then what are the chances that the baby, a fairly sized or the same size as the last baby will still be able to pass through the birth canal. The other thing that we ask for is the previous operative technique. So if I wasn't the one who delivered the baby, I have to make sure that the previous incision was a low segment cesarean section, because for these cases, the risk of rupture is less than 1%, about anywhere from 0.5 to 0.9%. So quite
Yeah.
safe. But if it is a classical cesarean section, so if it was made like a vertical incision like that, then the risk of rupture, yes, the incidence of rupture may be anywhere from 2 to 7%, and we don't risk that. Okay.
Yeah.
Wow.
So yeah.
Can I just add on the dystocia as the reason for the first cesarean section? That
Sure.
in many cases it's not so much about the actual cephalopelvic disproportion, but in malpresentation, like baby is not at the right angle, like baby being posterior face up rather than anterior, right? So basically the size is all right, but the angle is not yet. It's not right. Plus, paired with the lack of mobility of the mother, sometimes just a few movements can help the baby gravitate towards the better angle and basically resolve that malpresentation. Or certain spinning babies exercise where that can be done prenatally to optimize the space in the uterus, to release certain tensions in the ligaments and the uterine muscles, to optimize the space and to conduct the baby in the right presentation and in the perfect angle. So in many times, those are the reasons for the first cesarean. So the baby got stuck, the baby was malpresented, but actually the size was okay. So in the preparation for a consecutive birth, especially if it's a VBAC, this is what I cover in my course very extensively, what exercises to do, what certain routines to do during pregnancy to optimize the balanced, spacious uterus so that the baby gets into the right angle on the left occipital anterior, so on the left side with the chin tucked in and presenting the smallest part of the baby's head diameter for an easy exit. And then as usually practice shows, the reason for the first cesarean, cephalopelvic disproportion, dystocia, is no longer the reason for the second, for in the second birth. It just goes well, it resolves.
So another
Sure.
note, no? So Irina mentioned the term dystocia. So it means that the baby cannot seem to pass through the pelvis, no?
Yes.
As a matter of fact, we have recently just adopted the different guidelines. Before, we would only wait 2 hours before arrest of the cervical dilatation. Now the guidelines are 4 hours now. So it gives
Oh, I see.
now it's 4 hours. So, the hospitals are really trying to bring down not only the hospitals, the society. This is based on studies by Zhang, and on review, it seems like the outcomes still seem safe to wait as long as 4 hours. So now that's what we do. We wait 4 hours before we actually call for dystocia. So also, if it was dystocia before, but the baby was 3.8 kilos, no, a big size baby, and the
Wow.
second pregnancy is only about 3.2, then of course consider VBAC or TOLAC if that is what the mother wants. Yeah, that is her
Wow.
preference. Mm.
Well, that's great that they're bringing it down. No, they're lengthening those times, and I think it really depends. No, your case for a VBAC it really depends, and you need to be in constant discussion again, like with your healthcare provider and with your team about what the situation is with your baby. So yeah, those are great answers. Thank you, Rina. Thank you, Doc Majoy. I have one question for Joy, and then another question for either of you. My own question naman. Pero for Doc Majoy, kapag po nanganganak po na yung doc, kailangan po ba naka-face shield at saka ng mask? Especially since pandemic na yon.
Alam mo, usually it would be the anesthesiologist who would see, but we remove the face mask and the face shield, but everyone else around would be wearing those.
Oh,
yes.
yes.
So it's a two-way thing, the way to protect each other, no? So sometimes, imagine wearing and then there's a mask there and the face shield. It's very difficult, and then your
hard.
face shield fogging. So we do remove that, and then but everyone else around, the whole team,
Yeah.
everyone else will be wearing their own.
That's great. That's great. Another thing, so for either of you, Doc Majoy or and Irina, you can answer this. My question is, I know that it's easy for those moms who are low risk to have gentle births and to have gentle birth options. But what are the options for moms who are clearly in high risk pregnancies? What are their options for to have to have gentle births or to have or to have as many birthing options as possible.
I can add from my end. So, for example, if the mother is high risk, that a cesarean section is recommended right from the start, and that is the safe option for her. There is also such a thing as gentle cesarean. So it's basically a few tweaks in the environment. You can even have like a background music, presence of a loved one. Um, uh, I haven't seen it yet being done in the Philippines, but I've seen it being done internationally where the shield is being lowered down, where
Yes.
there can be actual witness to the emergence of the baby and can even reach out and pull the baby with the support of the medical care providers around her to and immediately place on chest to chest, skin to skin. Yeah, so, and of course, the continuous skin to skin contact, initiation of breastfeeding, and like more calming and family centered environment. So this is just a few things that can be requested for a gentle cesarean approach.
Okay.
Mhm.
Okay, not all high risk patients will have
That's
to
correct.
deliver a cesarean section, but what's important is that the whole time during labor they will be monitored very well.
Mm-hmm.
So we will be able to pick up signs of fetal distress and the baby not being
Yes.
able to tolerate. So basically, it's that I think that's why also the recommendation is fetal monitoring at least every 15 minutes. So that would mean almost continuous fetal monitoring for such patients. Okay.
Mm.
Yeah.
So, but doesn't necessarily mean the CS. But I agree with those would be good steps to take, no, for a gentle cesarean. When
Yeah,
I
Yes.
yeah,
some
we asked.
some of that has been done. Some of
Mm,
that has been done already
yeah.
here locally. But yeah, those are mostly international examples that I'm.
Mm-hmm.
Yeah, and again, on one-on-one support. Sometimes if the doula can be allowed
Yeah.
in the delivery room, like as it was in the pre-pandemic times, I assisted specifically several scheduled cesarean sections just to bring in the comfort and support, emotional support for the mother. Because it is a stressful procedure to go through. So just to be there to reassure, but it's also something that the partner husband can do. And
Yeah.
for example, yeah, a few things that can be also adjusted, tweaked for labor with the high risk pregnancy, as Margaret said, it's not necessarily automatical CS. It just requires closer monitoring. Again,
Yeah.
adjustments to the environment, have a calming background music. So it's still the
Yeah.
same kind of hormones that need to flow. It's still the
Yeah.
sense of privacy and trust, dim lights, presence of a support person who is someone with whom the mother is very familiar, whether it be partner, husband, or family member, or a doula. So really, mother's emotional comfort uh,
Sure.
that has to be ensured for a more gentle approach.
That's great. So yeah, I think my big takeaway is that if you're high risk, it does not necessarily mean you will have a C-section. You just need to be monitored, and you need to there can be tweaks to the environment. That's great. Okay. Another question. There are a lot of questions coming in now because obviously I know you guys have finished your session. So, question. Uh, this is from Mommy Alcebar, asking for my cousin, ilang years po ba pwede magbuntis ulit if CS ka? So is there a timeline, obviously, between, your your CS deliveries, or for safe ones. Um, Doc
Gen-
Majoy.
Generally, we would say at least 18 months interval. Okay, but
Oh,
18 months interval.
I didn't follow that.
You got pregnant right
after
away.
12
Yeah.
after 12 months I got pregnant again.
Okay. But family planning, if you read the literature, it will all vary. 2 years, 3 years, 5 years. But I believe that a lot of it is dependent on the social, psychological, emotional readiness of the couple as well.
Sure.
So, yeah.
Okay. Last question. For either of you, Irina or Doc Majoy, or both of you can also chime in on this question. Is it true that that really having small pelvic bones is one of the reason why some have to undergo CS? Like in her case, the mommy Joan is asking. She had to go undergo a CS because of a very small, very small pelvic bones.
I think I already covered
Yeah,
this question, that yes, sometimes it is indeed the case, or sometimes even though the perception is that it's a small pelvis, but the baby is actually still right size for the pelvis,
yeah,
but might be not in the perfect angle. So what needs to be worked with through movement, gravity, and balance is the position of the baby inside and the presentation. So this is where
sure.
we need to have the freedom of movement. So something that can be done during pregnancy, specific routines, specific exercises, and also during labor. And if that fails and the baby is still not descending, so then yes, then we are talking foolproof about a certain level of disproportion. But usually it gets resolved. Somehow
Yeah,
this body still tend to create babies just right fit for the mother's side. Mm.
Okay,
that's right.
so you understand that even usually a term at about 37 weeks when we do our baseline internal exam, we do some pelvic measurements. Now we sweep our
Oh,
fingers,
yeah,
check the bones, for bony prominences, if the diagonal conjugate is so and so. So they'll give us an idea whether or not the pelvis seems a bit smaller. But we always tell the patient, even if we think that it seems small or it seems a bit, narrow, the passageway, we still try for normal labor and delivery. And why is that? Because we believe that maybe the baby can position itself properly, to go through that birth canal. So, without the trial of labor, we cannot really say that the pelvis is too small for a baby.
that's right. Okay. Again, Doc Majoy, Irina, thank you so much. Thank you for being with us this morning. Thank you for answering our questions. Thank you for sharing your insights and your information. Hopefully, we can ask more questions with you guys online. We can share, obviously your contact details so people can get in touch with you. I also want to just acknowledge everyone who's tuned in from not just the Mommy Mundo Facebook page, but also the Huggies page. Thank you so much for sending in your questions. And I also want to share, again, Doc Majoy, if there are those who want to ask you questions that still haven't been able to get in their questions for you this morning, how can they get in touch with you?
You can go through this. I've done it before. Then I just
Mhm.
responded to all the questions and
Yeah,
typed it. Because I don't know how they were able to disseminate it, but
yeah.
we've done that before. Yeah, no problem. Just ask away.
Ask away. Well, Mommy Mundo will gather the questions. And Irina, we can ask you questions through your Instagram page. Or are there other, yeah, just your Instagram, birthing_gently. Um, Perfect. Okay. Thank you so much for your time. We That's all the time that we have for today. But of course, I know there are lots and lots of questions about this. So keep sending in your questions. We will try to get those answered as much as possible. But we're concluding our session for today. But before I let everyone go, I want to remind you of our game. Don't forget to answer our question in the comment section. Uh, and also our raffle. So don't forget to visit bit.ly/babyhugs2021 to view the full mechanics and get a chance to win 1 month's worth of Huggies diapers. The link is pinned in the comment section. And again, of course, don't forget to answer what is your birthing method, or what birthing method would you choose and why. And also, if your comment wins, you will also get 1 month's worth of free Huggies diapers. So wow, what an amazing morning. Again, thank you. I just want to thank again Doc Majoy and Irina for such an amazing, amazing session today for Baby Hugs. We hope that everyone also on our Mommy Mundo Facebook page and our Huggies Facebook page, I hope you learned a lot. I hope you continue to search and be empowered for your birthing method. There's so much we've learned, and there's so many more, and there's so much more to learn. And also, there are a lot of great giveaways. There are 2 great giveaways. I hope that you can join in on that. Thank you to everyone who joined us today. Again, mommies, don't forget, watch out for the Super Brand Day of Huggies on its official store on Shopee on July 17, where you can get up to 40% of 40% off on Huggies Dry Newborn and Huggies Baby Wipes. So that's 40% off on Huggies Dry Newborn and Huggies Baby Wipes on July 17 at our Shopee official store. So what are you waiting for? Please don't forget to add it to your cart. Add all of your Huggies favorites today. And stay updated on our live sessions and workshops on Mommy Mundo by joining the Mommy Mundo community. And if you haven't done so, go to the website. That's www.mommymundo.com and click the sign up now button for an instant access to exclusive news and updates for the latest events, parenting podcasts, and news. And lastly, don't forget to give the Mommy Mundo podcast a go. The hashtag you the mom, a follow and a listen, and you can find it on Spotify and Apple Podcasts, or anywhere where you listen to podcasts. So thank you again for watching and spending time with us this morning. I hope you guys enjoyed that. My name is Isa Fabregas Cuna. Have a happy weekend, everyone. Thank you and goodbye.
Change was a distant word. There was a time that would only encounter it a few times in a decade. Today, I know that every day will bring change. There will be moments where I'll embrace it, but most of the time, I know I'll resist, hoping to fold the edge of the page of what has become my favorite story yet. I knew you before I met you. That's a funny thing, but I still had so many questions about you and to ask you. The pain with which you came left me breathless. From then on, nothing has been the same. I see myself in you, and in the same time, I see all that you do through you. Discovering every color and note with you, learning how to smile despite the weariness, developing the handy skill of doing everything half asleep, staring helplessly at every how-to-parent guide available. Those first few months felt like a blink, so I kept my eyes open, hoping that I wouldn't miss a thing. These moments are rare, but I know that even for a little while, on days like today, when the wind is still and the sun lingers, I can take a mental picture and hold on to this memory, comforted that it will never change.